story time, I got was recommended to go to the ER by the surgical nurse line because I was experiencing some really crazy numbness that like started in my cheek here and then like went up here and then started traveling down my arm and my leg. And I had this kind of like fuzzy, weird feeling, but I assumed a lot of it was because of like the anesthesia exiting my system and the other medications that I don't normally take. And I'm a very regimented, cautious med user. I like to take a heavier on the naturopathic side of supplements and vitamins and getting my daily needs in through foods. And I also believe that allopathic medicine has a place that is very beneficial to survival on this planet. Sorry, just a little nausea. Okay. So I sent a portal message to the nurses line for my surgeon, and they called me back and they're like, hey, you have numbness and, you're 2 days post-op. We want you to go to the ER. You're not going to like this, but we want you to go. Of course, I immediately start crying because I'm like, I knew this was going to happen and I don't want to go. And if you've known me, I've had many trips to the ER throughout the time since I miscarried in 2019 to present day. Just a lot of really scary health stuff. And nobody wants to go back to the hospital after having surgery. It's just like you made it through the big gauntlet and you're like, I just want to get back to normal. And obviously time is time. And now I'm thinking of Adele's Let Time Be Gracious. Or Let Pain Be Gracious, Let Time Be Patient. That's what it is. Let time be patient and pain be gracious. This is, okay. This has been my post-op healing anthem is Adele's Hold On from the last album that I got. I don't know if she's released anything since that album. Anyway, so of course my hubby is dealing with a work-related emergency. And I am on my way to NYU Langone in Cobble Hill by myself. Very swirly and in pain from surgery. And I go in, I tell them what's going on. They're like, oh, your right lip like isn't moving as much as your left side. And I'm like, okay. And they're like, so we're going to get you back right away. The nurse practitioner talks to me, or the PA talks to me. And they're like, listen, we're going to get a consult really quickly with neurology. If it's what maybe we think, things are going to move really fast. It's going to be really overwhelming and really intense, but you're going to be okay. You're in the right place. And I'm like, what do you mean? So suddenly I'm hearing like consult bed 6. And I'm like, what bed am I in? Okay, I'm in bed 6. That tracks. That's what they said. Then I hear stroke protocol or stroke code bed 6. And I'm like, huh? What? Excuse me? At my age? And I know that anything can happen post-surgery. I'm a fairly healthy person outside of chronic illness. I've got a pretty decent resting heart rate. I don't smoke cigarettes anymore. I've been sober, nicotine-free for 4 years. So color me surprised. All of a sudden, 6 people come in. They're like, take your top off, put this thing on. They're hooking me up to all these different things. They're wheeling the bed down the hallway. They're like, we're giving you a CT. We need to do a CT with contrast. We're hooking up with an IV. If you have been to the hospital as a chronic illness frequent flyer, you know that once an IV goes in your arm, you have to buckle down. You're going to be there for a while. And post-surgery, Lauracia was not excited about that. But the nurse's line said, this is what you should do. I don't want to have a pulmonary embolism or a clot or, let's just make sure everything's okay. All right. So we do that. And they take me back. They're taking some blood. Shout out to the nurses team who were like just a myriad of different personalities that were really helpful in this experience. One of whom was really funny. And I really appreciated the levity in this otherwise harrowing moment. So then I get there, I'm laying there, waiting for a little while. My husband's about to come. He gets there, he walks in like behind the PA, and I'm like, I know you. And they're like, good news. It doesn't look like you've had a stroke. We saw no signs of pulmonary embolism. So I'm like, great, awesome. Can we take this IV out? Because I'm like, I just want to go home. If I'm okay, tell me if I need to stop taking a certain pain medication. Maybe the gabapentin is causing weirdness. And so neuro is like, what's this history of migraines? And I'm like, oh, I haven't had one in a few months. I saw a neurologist at Mount Sinai. They gave me medication that I didn't take because I'm med sensitive and I don't like to take medications that I don't have to. So there's that. So they're like, it could be the combination of your regular meds plus the gabapentin plus the post-surgery like anesthesia is causing like a flare-up of a migraine. And I'm like, oh, it's never presented in right-sided full like body numbness, but you know, anything can happen. And like, so we're going to give you magnesium sulfate. I'm like, I hear a magnesium. And so I'm like, okay, we're going to give you fluids. And I'm like, okay, that sounds fine. And we're going to give you Reglan. And I'm like, okay, Reglan didn't flag for me because I've never had it before. I've had a migraine cocktail that had 2 things in it that I prefer not to take, one of which is Toradol because it gives me heart palpitations, and another which like causes anxiety. It wasn't Reglan, it's something else. It's a triptan or something like that. So I was like, okay, that sounds like a pretty light migraine cocktail. Of course, I was very out of it, so I didn't think to do my handy dandy trusty Google of said medication to just listen. I trust doctors, and also I've spent 7 years experiencing medical gaslighting and being told that my anxiety is just changing symptoms, even though my psychiatrist and my regular healthcare team doesn't believe that that's what's happening. I have been told by quote unquote PCOS and endometriosis specialist, a person in Michigan, that I had mild PCOS and there really wasn't anything that he could do about it, even though he's supposed to be like a specialist. I've been told to lose weight. I lost 75 pounds. I've been told I need to lose more weight. I've had people look at me like I'm not actually a certified stop Pilates instructor and go, oh, that's so good for you. So you teach Pilates? So you'll pardon if I'm a little bit hesitant when I'm being given through an IV medications and I don't know what they do and they may be anyway. This team was great, and it's not their fault that what happened next is going into the television show that I'm going to write about medical gaslighting, or about my journey through the healthcare system as a plus size queer Black person of color. So they give me the Reglan. There's something wrong with the time drip for the magnesium sulfate. So they go to like figure it out. It's beeping. If you're following along this crazy ADHD journey, I'm oversensitized to like bright lights. If you're having a migraine, like bright, none of this is being in the ER is a terrible place to be for a migraine. So the thing's beeping because it's not working. I've accidentally unhooked the lead to something, so my monitor's beeping. The lights are on bright. No one, like everyone's like reeling from the stroke code that was called or protocol or whatever. And then all of a sudden, I start sweating, like immediate. Like I'm looking at the thing, it says 72 degrees. I was comfortable, maybe a little bit chilly, which is like to be expected in my post-surgical state. I'm sweating and I'm rolled over toward Christian and I'm like, I need to go home. And he's like, okay, baby. And I'm like, no, you don't understand. I need to leave. And then that ramps up to a full-blown, what I think is a panic attack. And in my brain, I'm like, why? Okay, it's post-surgery. There's a variety of different meds that have run through my system. I've just gone through the trauma of surgery, the grief and relief of finding out that I have signs of atypical endometriosis, that the way that my uterus looks suggests adenomyosis, that, you know, there's stuff happening there. And so I'm like, it would be totally normal to experience panic in this moment. And then I tried to get out of the bed, take all the leads that were on my body off from, I think, the EKG. I proceeded to claw toward my IV, at which point Christian put his hand, I think, on my arm, covering my IV and was like, hold on 1 second. They hear me crying, hysterical. The nurse that I hadn't been dealing with, who was very kind, came in and was like, hey, okay, so you're having a panic attack? And he's like, I don't think this is a normal panic attack. This is not, she doesn't usually try to claw things out of her body. It's usually more of a freeze and shut down. And they're like, well, listen. The worst thing you can do to someone when they're having a panic attack is baby talk them. And I don't want to generalize, but the worst thing you can do for me if I'm having a panic attack is baby talk me. I need to be grounded in reality. I need to be spoken to like a human being experiencing a crisis. That does not include your heart rate is fine, your respiratory rate is fine, see, you're okay. So do you not want the medication? That, in whatever state I was in, made me very mad. So I was like, okay, fine, like hook up the medication, but something is wrong and I need to get out of here. So then she's like, okay, let me go grab the doctor. They grab the doctor. They're like, hey, we're so sorry. It turns out you're having a very rare but expected reaction to Reglan. It's called a cathesia. It basically feels like you want to crawl out of your skin, out of your body, and immediately leave where you are. Okay. So my husband is like, so can I give her the Ativan? Can I give them the Ativan that's in their bag? And they're like, no, obviously we can't, like, you can't, we know this, but he's like panicked and being a great partner and is like, please listen to this human that I love, who I have watched get gaslit by the medical system. And they're like, we're going to give you Benadryl. The Benadryl is going to reverse the reaction that you're having. And then we're going to hook you, and then we're going to get the rest of your stuff online. I didn't even have fluids at this point. The magnesium drip hadn't started working. So now I'm dealing with facial numbness, the trauma of going through a stroke protocol. Glad that they acted really quickly. And I'm reminded of an episode of The Pit, which I love, where a woman comes in, spoilers is very early in the season, so stop watching here. But a woman comes in and they are being like verbally abused by the EMT. They're having a very violent, visceral reaction to something, and they're obviously Black, and they're being accused of being drug seeking. And then a Black doctor who is femme presenting comes around the corner and is like, whoa, everybody chill out, pause for a second. Ma'am, do you have sickle cell? This person's dealing with a crisis. And then they give them the pain meds they need. So I'm like in this Reglan reaction state, revisiting this scene from The Pit, and it's actually oddly calming. This is why representation matters. This is why DEI matters. This is why diversity, equity, and inclusion matters. This is why this current administration and MAHA, Make America Healthy Again, is fucking bullshit. It matters to have people that look like you, that have spent their lives familiarizing themselves with the gaslighting that people that look like them endure in the healthcare system in this country and probably other places. It is very important to have visual representation of that in storytelling form. Why? For moments just like this. Not only for the staff and the doctors and the nurses and the medical professionals working in the institution, but for the patient. It was a thread of sanity for me in a moment of utter insanity, of feeling like I could not trust my surroundings, my body. The only thing I could trust was my partner. It was important for me to have seen that episode of television and for me to have been able to recall it in that moment. So there's nothing wrong with wanting to create circumstances where health is wealth and is human right. The way that the Make America Healthy movement and the way I see a lot of health and somatic and nutrition and wellness influencers approach it is devastatingly one-sided and ignores the very real lived realities of people that look like me. And so it's really important for me to take that detour. So they give me Benadryl, and immediately in my mind, I'm like, well, I'm on Wellbutrin, and Wellbutrin and Benadryl can sometimes cause serotonin syndrome. And I flag it, and they're like, oh, you are. We can still give it to you. You're not on a super high dose of Wellbutrin, and it's not a super high dose of Benadryl. Thank you for flagging that. So it's also important to know the medications that you're taking and the supplements that you're taking and the way that these things interact with your body. You know your body best, even if a blood-brain barrier crossing medication makes you feel like you don't know your body. In all of that insanity, I was still able to flag a potential interaction. So the Benadryl's on board. My pain is spiking because this episode left me very physically agitated, which was not great for the 4 incisions I had for my surgery and the pain from getting endometriosis excised from my body. So luckily, they had given me extra strength Tylenol when I got there. More on that in another health story. And they were like, you're due for your next pain medication. We're going to give that to you as well. Finally, I breathe, I exhale for the first time, I think, since really getting there. And Christian exhales, and he's feeding me ice chips and water. And then I just kind of fall asleep for a little while. And that was day 2. And then I had this weekend, and I'd weaned off my pain medications, and wow, I've spent all my energy telling the story, but it's really important and fun for me to tell, and so here I am telling it. And now I'm trying to get my gut going again, using senna peppermint tea and prune juice, trying to wait on Miralax. I've been lucky enough to have had a couple of bowel movements, but things are still slow to get moving, and so that's what we're working on next. Anyway, TDLR. I don't even know if I'm using that phrase right. Long story short. Be gentle with yourself. This is really just for me. Lauracia, be gentle with yourself. You're doing great. You know your body. I'm sorry it's taken so long for people to believe what you knew was happening on the inside. So that's all I got for now. I think I gotta go to the bathroom.